folks, we ready to roll? All right, well, good morning and welcome to LouVax from Broadbent Arena. Even more national fame now. I'm sure everybody saw that it was on Wednesday, a front page of the New York Times was showing how mass vaccination sites work and wanted to see the most efficient one in the country. So hats off to everybody here that's done a great job for LouVax. I think we got over here. This is the story that was the pictorial essay running in the New York Times, and well, that's pretty good. The front page of that. So, well done. They could have gone anywhere in the country, and they came here. The Wall Street Journal was also here last week, bragging on Louisvillians and everybody here at Broadbent. Way to go. Dr. Hartlett couldn't do it without our volunteers ever. So that was a proud moment for us to get little bragging rights from some of my mayors around the country that called and were jealous of all we've done. So I bragged on our public health department. So that was great. We've been having, as everybody knows, an emphasis on getting our kids back in school. So we've been using this site as a way to bring JCPS nurses, elementary school, middle school, high school here. We'll be hearing from Dr. Polio here in a moment. But you can feel the excitement in the city in terms of people saying, yes, the kids want to get back to school. How often do you hear that? And then, of course, the parents want that to happen as well. So we'll have an update from Dr. Polio on that in a second. In terms of overall cases in the community, I'm happy to report that for the second week in a row, we're continuing to see a decline, but there's still too many. I mean, our incidence rate is just around 50% or so. You know, you go out of the red zone at 25, we are declining. That's the good news. So we're just kind of in a race. We're in a race against transmission and a race to vaccinate more. And of course, the number one issue that's stopping increased vaccinations is supply. However, President Biden and his team have announced that we'll be receiving a 21% increase, so that's the good news. There'll be much more manufactured availability of the vaccine in 6 to 8 weeks or so. And then, of course, the Janssen vaccine is applied for emergency authorization as well. And they've said that they will supply 100 million doses by June, I think it is, which is their commitment. So what we're doing right now, obviously, is we've got a lot more demand than supply, but coming up in the 8 to 12 week time period, we're going to have huge amounts of supply. So our vaccination task force is working not to just deal with the issues of today, but then thinking ahead 2 weeks, 6 weeks, 10 weeks, 14 weeks to say, how can we have vaccination availability almost everywhere in the city? And then we've got some other innovative techniques to make sure that we are moving toward herd immunity. So a lot of good work going on in that. We're still seeing some hesitancy and skepticism of getting vaccinated from some populations, black population in particular. So we're working on education and training, and we'll have different highlights associated with that so we can make sure everybody knows the science and everybody knows the facts behind getting the vaccine. Scientifically proven and safe. Okay, vaccinated is the best way for each one of us individually to stay safe, keep our families safe, and then also reopen the economy. So lots of excitement around all of that. All right, so let's also make sure that if you can't get vaccinated, everybody can wear a mask. Okay, and there is just more and more evidence that masking works up. I was watching the news this morning, little Super Bowl preview. Sorry, Mark Hebert, about that. But Buffalo Bills fan here, and they got close. Kudos to the Bills. They did a nice job there. And they helped our blessings in a backpack here locally because there's some really classy fans in Buffalo. Got him on a sidebar here from Mark Hebert, but he deserves it after years of suffering in the wilderness. But what the NFL experiment showed, the number one thing the guy said, NFL getting through this whole season because of masks, and they've scientifically followed that. So please, to the community, if you're not wearing your mask, please do so. Think about double masking as well. Maybe Dr. Hartlett, you can speak about that as well. So now for an update on what we've got going on here, our Associate Medical Director is doing a wonderful job, Sarah Beth Hartlett.
Thank you, Mayor. As always, we're going to start with some brief stats about vaccination locally. So across the metro area, which would including all 4 providers here, LouVax, plus our 3 hospital systems, As of end of day yesterday, we have administered 90,379 vaccine doses, which is 72,986 primary or first doses, 17,382 boosters, meaning that 17,000 folks in the metro area have completed the entire series. And we've now crossed the threshold where 10% of our population has been vaccinated. Here at Louvax specifically, we have given 23,180 doses total, which is 21,548 primary shots, 1,632 boosters. As you know, the last couple weeks have been primarily focused on educators, and this week we've had middle and high school educators through the facility. We'll be wrapping up our educators early next week. We have 507 JCPS staff remaining to come through. Most of those are central office folks and administrative people who are very important to running the school system, but maybe have a little less direct student contact. And we'll be completing our first pass through the JCPS population on Tuesday, February the 9th. As the mayor said, we can't run this site without the help of our many, many volunteers. So volunteer update, we've now had over 2,000 people that have participated on this site, and they've collectively contributed over 25,000 volunteer hours. We've vaccinated 141 of our volunteers who have achieved 40 hours, and that number grows every day. I'm going to recognize a couple of specific volunteers this week. First, I have a pair who's been working at the pharmacy station with me, making sure that our injectors are well supplied and that our inventory is kept on track. I have Dr. Regina Puno and Kelly Kane, who's a medical student. And both of them were here for a record day this week when we did 1,589 shots in just one day. Next, I have Mr. Charles Hopkins, who's one of our most reliable volunteers. He's been here every week since we opened. And then we mentioned last week that we would be starting a new software system here, and some of our volunteers really stepped up to help us with the expected and unexpected bumps that we found in that rollout. So this next group is all folks who really helped get that rolling this week. So I have Sarah Brown, Virginia Hoffman, Clarice Deneau, and Deborah Hibbard. And then finally, our staff member of the week this week. Again, we have over 40 staff here on site from 19 different metro agencies, and additional staff working behind the scenes off this site as well. But today's staff member of the week is our IT lead here on site, who's made sure that all of our laptops and iPads are functioning as they need to. So thank you to Trevin Hunter for getting us through the week. We have vaccinated 10% of our population, which is an awesome milestone, but we're still a long way from herd immunity. We're going to keep chipping away at that, but we do encourage you, as the mayor said, to continue to wear your mask, social distance, wash your hands. The good news is that the vaccine data says that it is still effective against the variants that we've seen popping up in other places across the world and across the country. So that's good news, but we are keeping an eye on that. Some folks are recommending double masking. There's definitely no harm in doing that. It's not something that we're making mandatory or anything like that at this point, but it's definitely something to consider if you're going to be out in public and outside your little safe cocoon or safe pod of people that you've been around this whole time. So thanks, Mayor. Back to you.
All right, nice job again. Thank you. And I want to also highlight the members of the Metro government team. You know, this pandemic has really changed a lot of work patterns. So folks that are not working in their normal job because of the pandemic are doing things like coming out here and helping in Broadbent and filling in different areas. They're also helping in our resilience and community services team to help on social service relief, rent relief, that type of thing. So we're trying to show the flexibility that's required during something like this. Hey, I mentioned the Super Bowl as well. So let's encourage our citizens not to have big Super Bowl parties, okay? They are really great candidates for spread of the virus. Getting together, yelling, cheering under normal times, we would love that. But that is a recipe for a disaster here this coming Sunday. So we'd encourage people to enjoy the Super Bowl in the privacy of their own pod, whatever that might be, and look forward to a bigger time next year. So I know that the media will be helping spread that word. We're not trying to be, I don't know what the right analogy is for the Super Bowl. We're not trying to be the Grinch on this, but we're trying to keep the spread down. So please do your part here and enjoy the Super Bowl responsibly. All right. Speaking about responsible, progressive leaders, Dr. Polio is here to give us the update. We've kind of been partners out here for the last 3 or 4 weeks now as we've rolled out this vaccine at JCPS so we can get our kids back to school. So, Dr. Polio, if you'd give us the latest, we'd appreciate it. Marty Polio.
All right, thank you, Mayor, and welcome to everybody being here. I want to go back about 6 weeks ago to December 28th when the governor said that we would start February 1st and we would start K through 12 educators, give or take a week. That was on a conference call with all superintendents across the state. And I thought at that time, you know, how in the world are we going to get 13,000 educators get through this? I mean, that's going to take a month to do that. And here we are 6 weeks later. We're on day 11. Day 11, where we will now finish up with our schools. So it's so great to walk in here and see a bunch of Southern educators at the other end with the mayor and taking a picture with them and being able to see educators in person again. And the excitement that a lot of our educators have going through here. But I mean, we think about that. By the time we finish this, we'll have over 12,000 vaccinations. We're finishing up with schools like Southern and Seneca, Wagner, Valley, Western, the end of the alphabet for high schools. And that's very inspirational to me. But it took 11 days. What is it, February 4th? Is that what? February 4th. And it was in the original give or take a week to start the vaccinations. So first of all, I can't say enough about Dr. Hartledge and her team and all of the volunteers here who have been so great to get us through this so quickly. I've talked to so many educators about going through this process, you know, and I thought it was, I mean, people are going to be sitting in the line for 4 hours. And I mean, it's anywhere from 30 minutes, you know, to the lengthiest time being about 90 minutes. And that's just an awesome accomplishment for this city and for us working together to get all of our educators. So thank you, Dr. Hartledge, for your work and all of the volunteers here. I know it's not everybody here, but you guys have been awesome, and you're really helping us out move forward and closer to getting our kids back. So that's so exciting, and we know we'll have the booster coming up starting on February 19th, hopefully. We'll be monitoring when we get that, and that'll be an important step for us too. The booster will go through the same process again, and getting our staff through the booster. And so once we know that, I'll be looking forward to making a recommendation to our board about possible dates for return to school. We know the timeline on it. We've said that multiple weeks in a row. But I'm looking forward to making that recommendation to our board and getting our kids back in school. Can't wait to do that. And we are so excited. And I've talked to so many teachers who are excited about this. I know our board members are out talking to our teachers, to the community, getting feedback, and they've got a tough decision to make as well. They will be the ones making the decision on the return to school. We'll make that recommendation to the board. I'll make that recommendation, and then they will be the ones making the final determination and decision about a start date for in-person school. But we look forward to presenting that plan because our schools are ready. Our schools are working hard to ensure that we'll have the social distancing, the masks, all the PPE, and we are working very closely with all of our schools. So it's an exciting day. Can't wait for round 2 to start so we can get one step closer to being back in school. And also happy to have 2 administrators with me here, 2 hard-working JCPS administrators who are great leaders in their schools. So the principal of Southern High School, Dr. Tyler Sheeran, is with us, and also assistant principal at Seneca High School, Narika Dixon, and I believe they're going to get their vaccine here shortly, but I'd like to bring them up to say a few words.
Thank you, Dr. Polio. It's a privilege to be here today. Excited to get our first vaccine shot. Excited for all of JCPS in Louisville at this stage. And very appreciative to all the workers. Great to see some of y'all acknowledge that made this happen. So for me, the vaccine hits both personally and professionally. On a personal level, I first got to say that there's been others impacted far more than I have by the pandemic, but it has impacted me. There have been opportunities missed to see family members. There's been events that have been downplayed out of the need for safety, and that's the sacrifices that all of us have made and make willingly and will continue to make until we're through this. So this weekend is my younger brother's 30th birthday. We're excited for that, but we're also going to be in our very, very small pod, and certain family members will not be able to come in and be a part of that because of what we're going through. Professionally, I spent last night at a JV basketball game. That was fun. It's great to see a few kids doing something they enjoyed. They're happy to see me. I'm happy to see them, but it wasn't what it should be, or what they're used to. We're distanced, a lot of masks, following all precautions, limiting the number of visitors that are there to watch the events, and kids have missed out on a lot of opportunities over the last 11 months. I look forward to getting back to those. I look forward to getting staff back in the building. I look forward to seeing in-person teaching and learning, but we all know that's more effective. We've gotten better at NTI. We will continue to work hard at that and continue to do our best, but students in classes is what we all want to see. So if the vaccine takes us towards that, I'm excited to get my shot today, excited to have Southern staffs vaccinated, and appreciative for everyone who's made it happen. Thank you.
Good morning, everyone. Thank you so much, Dr. Polio, and thank you to all of the wonderful volunteers here and to everyone that's making this possible, the vaccine for us. At this point, everyone, I don't care who you are, I don't care what walk of life you come from, everyone has been impacted by COVID-19 in some way. Personally, I have members on both sides of my family that have contracted the virus. Some of them have had mild symptoms, and I've had my brother-in-law who had to spend some time in the hospital as a result, but he has recovered, thank goodness. So all of us at this point, now that we've been in this for a year, have had some type of impact, whether it be a family member or a friend or a relative, or even an economic impact of the virus. A year ago, when we left our buildings for what we thought would be a couple of weeks maybe, no one could have imagined that a year later that we would still be working from home and dealing with the impact of COVID-19. But now there's hope. And so we're really excited that there's a vaccine. We're so thankful that the health department and the state and all of these wonderful volunteers have made it possible that there's a ray of hope that we will get back to in-person. We will get back to seeing our scholars again. One of the things that I miss so much is my seniors. This time of year, I'm notorious for seeing my seniors in the hallway and asking them, have you applied for college? Have you gotten your housing done? Have you filled out these scholarship forms? We've got to do this, we've got to do this. And missing those opportunities at the end of last year and now all the way to this point in this year. Much like Tyler, I was at a game last night at Seneca, and one of the cheerleaders came up to me, and this is one that I've worked with on applying to college, and I'd sent her some links through email so that she could get her application done, and she was so excited to come and share with me that she had been accepted. I said, okay, now we've got to do your housing information. We've got to get all this stuff done, and we've got to apply for scholarships. And her mouth kind of dropped, and I said, no, I've got you. I'm going to send you some links tomorrow. So it's so exciting that we can still do those things virtually, but it means so much for those scholars to come into the building, and so we can see them face to face, and we can have those conversations and those real impacts on their lives. The scholars miss us, we miss them. This morning I was able to see some of our Seneca staff in person. You know, you see the smiles and you're waving, and it's really exciting because while we can do some of our work virtually, being face-to-face means so much, and those real human connections mean so much, and we're a step closer to that now, thanks to all of the efforts of everyone here, and we just can't thank you enough. So, thank you.
All right, thanks everybody. At this time, we're happy to take any questions from our friends in the media.
Mayor, I got a question for Dr. Hartledge.
Dr. Hartledge, if you would repeat the question.
Dr. Hartledge, we don't want to forget the forgotten Louisville, the question about homelessness. You've been working on a plan for people who serve homeless as well as those experiencing homelessness themselves. Can you share that with us?
So the question is regarding plans for vaccinating and protecting the population of people who are unhoused or homeless. I'll reiterate what we said last week, which is that the first and most important step we can take to protect those people is to protect those around them and those who serve them. So homeless shelter staff is included in the 1A designation, and we have some more of those people coming through next week to increase the percentage of that population who is able to serve the homeless. We also have continued to provide safe places to isolate or quarantine for that population if they are exposed or infected. We definitely acknowledge the challenges involved in vaccinating them, especially with a delicate vaccine with very particular handling requirements, and then it also is a 2-shot series. And so we're really looking forward to the potential for a 1-shot series with another drug that may help us be able to more easily reach them. But we continue to work on population planning there and engaging with stakeholders in shelters and others who serve that community to try to get the best plan in place.
Will the volunteer outreach teams be included in the shelter staff vaccinations?
Will the volunteers be included in that plan? There probably will be a role for volunteers, but we don't know exactly what that's going to be yet. So the question is about boosters in general and also specific to the JCPS educator population. To date, KDPH has been able to provide us with a number of booster shots that tracks with the number of primary shots we've given, which is to say everyone who has received a first shot through this facility has been allocated a second shot. We have no reason to think that we can't progress through boosters just as quickly as we did through the primary shots. So it's 28 days later, so the last of the educators will come through here on February the 9th, and then it will be 28 days after that they'll be getting, Dr. Polio will be getting his booster, and there may be a few scattered, rescheduled type things after that, but in general, the mass of them will be completed 28 days after that. So to date, everyone who has received a primary dose has been allocated a secondary dose.
All right, thanks everybody for coming out. If you want individual interviews with our JCPS team, they will be available for that. And then, Kathy, if anybody wants to move around, can they do that as well? You want to close us out or anything else to say? Okay. All right, thanks to the media for covering this. Everybody have a safe weekend. Thank you. And volunteers, let's get a picture if we can. Yep.
Right here, please.
Thank you all for volunteering.
Is it okay to get the mayor, Dr. Polio, and then...
Sure.
Kathy, if it's step by... Yeah, step by.
Okay, thank you all. That's it? Let's go. That's me too. That's two. Thank you all for what you do.